Hi, everyone. I'm happy today. So, welcome to the Just Skydding podcast. My name is Chituru, and I'm your host. You can call me Chits in case it's a mouthful. So, today we're going to be diving into, I can never stop talking about healthcare as long as insurance is concerned. So, today we have more of that for you. We had that earlier, but we're going to be talking more about healthcare and insurance and why it is a big deal. I dragged someone out today. Noe doesn't like to be in front of the camera. She'd rather be behind. But look at how beautiful she is. Should she be behind camera? You guys vote. So let her introduce herself. We're going to be having a conversation around healthcare, accessibility, why health insurance is important. So
All right, thank you, Chitru. Like she said, dragging me out here was a big deal, but I'm here after all.
yeah.
So my name is Chinonye, and I work with Hygeia HMO as the regional sales manager for Lagos and Southwest. So I'm really happy to be here.
We're
Thank
so
you
happy.
for the opportunity, Chitru.
We're so happy to have you here, Noye.
Yeah, thank you.
So as just to serve as an icebreaker, what's the weirdest home remedy you've ever tried or you've seen someone try?
Okay, I can't remember anything right now. Have I tried any? I try to avoid all those home remedies and all that, but
Lick salt when pepper gets into your eyes. Have you ever tried
no. I've not tried that.
palm oil, honey?
Yeah, oh, that reminds me. Yes, palm oil, one thing. Anything you take, just take palm oil to neutralize
It will
all
neutralize
the
it.
chemicals and all that. So, yes, I've had to try that. At some point, something fell down and I didn't know it fell down. I picked it up and after eating it, someone had said, that thing fell on the ground. I'm like, and I just put rat poison here. I'm like,
Oh my
"What?"
God.
Oh my God. So I quickly just ran to get palm oil to just take to neutralize whatever I had
And you
taken.
felt okay?
You
Nothing
know
happened.
with these things you say whatever you believe in works for you.
Actually.
So I just believe that it worked and I guess
you
nothing
were
happened. I'm
okay.
here now, so I
My
guess everything is fine.
For natural remedies, mine is it always goes back to honey when you have a cough. There's this mixture that we
Okay.
do. It has honey, it has lemon, it has cinnamon,
Onion.
cloves.
Okay.
I'm not bold enough for the onion one
Okay.
because that's just it's too potent.
Okay.
Okay.
All right.
So let's dive into healthcare accessibility. So when it comes to healthcare, and people being able to access it, it's either it's too expensive, it's either it's not accessible when we need it, or I have had terrible experiences with Nigerian hospitals. I don't want to hear it. I don't want to put my money there. If I fall ill, I will go to the hospital and I'll pay and get treated. But I am not trusting any middleman to handle my healthcare expenses. So maybe you should throw more light on this and the common struggles that people face when it comes to healthcare accessibility.
All right. So like you said, it's been a struggle with getting people to understand health insurance in Nigeria space because first, sometimes when you speak about these things and they tell you, oh, is there health insurance in Nigeria? Does it work? If it works, what's the possibility of when you need it, the health insurance will actually come
through.
Yeah. So that's been a huge challenge. And I try to tell people that, interestingly, you don't know the need or the benefit or the value of health insurance till you are seriously sick or when someone you love is seriously ill, when finance becomes a problem.
Right.
Yeah, because we always assume in the course of our life that, oh, Jesus is my insurance, I cannot be sick.
God forbid.
God forbid it. Yeah, all those things. In the last 10 years, I've not had any need to go to the hospital. Why would I pay for something? Am I preempting that I'll become sick? So these are things that conversations you have and you try to explain to people the need for it. We're not praying for it, but ill health is not something people plan for. You need to put something in place just in case anything happens, you have something to fall back on. And the good thing about health insurance in Nigeria today is that the affordability is almost, you can't speak about it because there's health insurance for everybody.
Yeah, I
So
agree.
no matter the amount or the budget you have, there's a health insurance for you.
Yes.
And that's what people need to understand, that it's not a function of, oh, I need so much money. It's not a function of, oh, when I get to the hospital, I'm not going to have the access. It's not a function of, oh, you're tying me to a hospital if I'm in, if I have to travel out of Lagos, for example.
What do I do?
What do I do? So the good thing about it is that health insurance has evolved over time, allowing people to have access to affordable health care, allowing people to have access to hospitals regardless of their location and all that. So there's a roaming service available to almost all the insurance organizations that we have today. So it's something I try to encourage people. Try it. Let it be that you've tried and it didn't work than saying it's not working.
Yeah, and speaking of people thinking you need to have so much money, we are trying to change the narrative. Don't see insurance as a privilege. It's not a privilege that's available for a selected few. We're making it a right.
Yes, I totally
It
agree
should
with you.
be a right.
Yes.
Because there's no reason why you're roaming the streets of, I mean, I love Nigeria, but you're in Nigeria.
Yes.
And you do have health insurance.
Yeah.
How do you do it? Because the risks far outweigh whatever concerns you have. If accessibility is the problem, platforms exist. You are listening to one of the platforms. If affordability is the problem, plans go as low as 1,000 naira these days, even less.
Yeah.
Right? People are trying to. There's something called embedded insurance these days. You're not thinking about even buying insurance. You could be buying bread or something from a supermarket. Insurance is already factored in.
Exactly.
All you have to do is claim it and have your information, and if you fall sick, you go to the hospital. So there's no excuse. That's basically all we're trying to say. And then people also have, I'm not sure people really understand the difference in private health insurance and government healthcare schemes. What's the difference? What should guide my decision if I have to pick?
All right. So for private health scheme, it allows you, there's a bit of more coverage in terms of services. So you can have access to specialized care, specialists and all that, unlike what we have with the government health scheme, where it's a bit a narrow or basic health check that is covered. We also have flexibility also is an option when it comes to private health.
Okay.
Yeah, so you're allowed to have options, different plans available, or you can work around it just to meet your own need. Unlike what you have with the government health scheme, where it's already a straight-jacketed thing and you buy what you see.
Yeah.
And also the spread of hospitals. So in the private health scheme, you're allowed to have access to private hospitals all around Nigeria, for example. But in government, you have government hospitals or a few private hospitals. So these are some of the differences. And not forgetting the, of course, affordability. When you talk about government health, is a little bit less expensive. But of course, the more you pay, the more benefits
you have. The more benefits you can
naturally.
access.
Yes, so those are the basic differences between private
and government healthcare. So you have the option of choosing wisely. Thankfully, platforms like Skid give you options. If you want to go for a typical government one, it's available. If you want to go for a private health insurance like the Hygeia plans, they're also there. So please, you could always think about your options. So I want us to discuss how we can make health insurance work for families, because most times people think, oh, I'm just getting for myself and my wife and my children, but we're surrounded by so many other people who provide one service or the other. You can hardly find a Nigerian home that doesn't have a domestic staff.
Definitely.
Nannies, the housekeepers, your security men, you have artisans. Even though you don't want to buy for them, I feel like we're gatekeeping the information that's, Oga, as we do this plumbing work, there is an insurance plan that you can get. It could be someone who's coming to fix your lamp holders and things like that. What if they fall? What's the plan? Right? So I think that more people need to start understanding that beyond yourself, beyond your children, your wife, your parents, plans exist for other people who are around you. So maybe you should throw more light on it and what your experience has been so far with it.
All right, you too. Thanks once again. So with plans for domestic staff. So what we realized is, in Nigerian workforce or workspace, there's a large number of informal sector. So you see the artisans, the plumber, the mechanic,
They call them the gig economy.
okay, all right, that's new.
Yeah.
Yeah. So all those people actually should have access to health insurance. So taking it back to what you just said about having your domestic staff covered on the health insurance, you can imagine if your domestic staff, someone that is working with you or working for you, is not feeling well, how much you're going to spend.
Yeah.
Because you're not about to throw the person out
No.
on the street because
It's still a cost
yes,
for you.
it's a cost for you. So if you buy health insurance for this person, that takes away that cost or that burden away from you. So there's health insurance for everyone, like we had mentioned earlier. So regardless of who is with you, what they do, you should be able to buy a health plan
You
for
should
them.
be able to buy
You
a
should
health
have a
plan.
for them.
For
And there's
instance,
something for everybody.
yeah, my sister, the moment she gets, this is an example, the moment she gets a domestic staff, the first thing she tells me, please send Miss Kids link. Let
it's
them
also
sign
important-
up today.
Yeah, it's important for them to even run a check before you even
Yeah.
hire them, because
Oh, that-
sometimes people come with a lot of things.
Exactly.
So there's a need for you to actually know their health history to an extent before hiring these people.
Exactly.
That will also puts you in check.
So you mentioned something about getting a domestic staff before they even come into your home. They need to go and run tests. But this is beyond them. A lot of Nigerians are working about, you don't know your family's medical history. You've been battling a particular condition and you don't know that it's actually hereditary. And that's because we're not running the required periodic tests that are important to function as a human being. So I think you should mention how important it is to check your medical history and what can we do and what are the provisions that health insurance companies have made for that to be possible.
All right. Okay. So for medical history, is sometimes people do not even know. They don't have the opportunity to know their medical history.
Right.
Some people, because maybe they grew up in the village, their parents died while they were young, they don't even know what killed their parents.
True.
They don't know all that. But as an employer who is about to hire someone, it's important to at least have the basic understanding of what you are dealing with.
Right.
So when you are bringing someone into your space, your home, your office, whatever it is, you should be able to run the basics. Check the blood pressure, check the blood sugar, check the HIV status. It's important because for those that will be handling food, it's important to check their hepatitis B.
Yeah.
Are you sure this person is free to handle what you're going to eat and all that? Those things are things
you received today, you're cooking this afternoon.
Exactly. Those are risks.
Big
risks. Tomorrow the whole family is down.
Yeah.
And you're wondering, all those things are expense. You're looking at it that, how much am I it's going to cost me a lot going to run tests for this person. Have you wondered how much it's going to cost you when the whole family is down?
Right.
So these are things sometimes we need to check. Let's not be penny wise, pound village. Let's even understand, okay, what am I saving from just doing this simple exercise?
Exactly.
It can just take me like 10,000-15,000 to do this instead of having to have 100 and something or 200, even 1 million, everybody.
Exactly.
And the emotional stress of being sick, that's something people really don't think about.
You don't think about that aspect.
You're thinking about financial, it's beyond that.
Right.
So all those things. So it's important to check your domestic staff. It's important to know their history. It's important to have an idea. We're not saying if somebody is sick or you find out something, you should throw the person out. No. We're only saying that if you find out something, it gives you an edge. You understand what you're dealing with.
Right.
You're able to walk around it and manage the situation when the need arises.
Exactly. And then people say, my driver is always complaining he has malaria and typhoid.
And he's drinking abo.
And he's drinking abo. My nanny is always complaining of this particular thing. Don't mind her, she's just lazy. Madam, you could get them a health plan so that you actually can tell. In fact, you even need it for your own
Sanity.
closure and sanity. Go to the hospital. Let's actually see a report from the doctor that says you're ill.
Okay.
So that if they're taking time off, you know that they actually deserve it because they're ill, as opposed to just feeling like they're lying again, they're trying to be lazy, they're dragging their bodies. So this is something that is mandatory, in my words, for every home.
Yeah.
As
I
long as you
totally
have
agree
people
with you.
that
Yeah.
you're employing. Okay, so I want us to go into a segment that says health insurance hacks.
Okay.
I know most people think that the moment you've bought a plan, it's 1,000 naira or it's 50,000 per annum, right? Whether or not I use this plan, I will renew next year. So what are some hacks that... So there's that concern, and there's the concern of my plan may run out on me before it's even time for renewal. I may exhaust some of my benefits.
Okay.
I may not have enough. Maybe I may not be able to access drugs, pharmaceutical drugs from the pharmacies. So what are some hacks? What are some ways that could prevent you from exceeding or exhausting your health insurance limits before the time is due?
All right. That's the good one. So, off my head, when I'm talking to people about health insurance, I always tell them that there's need to use it when you need it.
Okay.
So, what most people do, or some people do, is they have health insurance. They believe they've paid for it. So, regardless of what the situation is, they walk into the hospital, even when there's no need for it. Say, sometimes I'm having headache, just drink water and rest a bit. Then if your call or the headache is not good, then you know, at this point, I might need to see a doctor. You don't have to, everything, you run to the hospital.
I'm guilty. I run to the hospital.
So you can actually manage your benefits. It's important to do that so that when you need it, it can actually come through for you.
Yeah.
So you don't have. I see. I hear. Let me not say I see. I hear. Some families, they just we bought health insurance. Every Sunday they carry the family. Oh yeah, son, daughter, mother, everybody. Let's go to the hospital. You were coughing
kidding?
yesterday. Oh yeah, cough. The child is like, I'm okay, I'm not sick. Say, no, you're sick. Doctor, give him medication.
People do that?
Yeah, people do that. And you're exhausting your limits. You are using this medication even when you don't need it. Because most of these drugs are taken from the hospitals. And when you get to the homes, you see the drugs, they are dumped.
Nobody's taking them.
Nobody's taking them because there's no need for it. So why don't you take or go to the hospital when there's really need for it?
Right.
Yes. Why don't you ask for this medication or go when the doctor prescribes? There's really need for the drug, not just the fun of I have health insurance, I'm going to use it.
So
okay,
is there's that, and then there's also, are there specific hospitals you go to that will finish your entire limits? You know, hospitals have tariffs.
Definitely.
The same way a neighborhood hospital may be more affordable than going to some of the big names that exist.
Okay.
The fact that you can access a wide range of hospitals with your plan, do you think that if people would utilize clinics that are close to them, primary health centers that are close to them for basic symptoms, as opposed to going to the high-end ones, do you think it's another way that can help them with maximizing their benefits?
Yes, definitely. So I know a lot of insurance like Skip, you have access to telemedicine.
Yes.
So that's something you can also use. That helps you to maximize your benefits. You don't have to necessarily go to the hospital to see a doctor. So if you have all these very basic symptoms or concerns, you can quickly speak to a doctor from the comfort of your home or office. So you don't necessarily need to go to the hospital. That's one. Two, you spoke about the hospitals and yes, we know there are some high-end hospitals and there are also lower ones with lower tariffs. So whatever your benefits is or your benefits are, is a function of how you use it, is a function of the hospitals you visit. So if you are visiting a high-end hospital and the hospital is treating malaria for 50K, for example, and there's another hospital closer to you that can treat the same malaria for 10K, trust me, it's the same medicine. It's the same thing. The same doctor experience. Why don't you just go there and take that 10K instead of going to the 50K, and in the next 3 or 4 visits, you are told that your limits have been
Mm-hmm.
exhausted. So like you said, yeah, there are different things, ways around that.
So I want us to also talk about some unexpected things that health insurance covers. Because I know people only think it's when, oh, malaria, typhoid, stomach ache, ulcer, asthma. What are other things that you will not think of immediately that people should be using more? And yeah, you could. You could.
Okay. All right. So interestingly, some people have health insurance and don't really know what they are covered for. So there are other things you can do aside the medical
Mm-hmm.
needs. So you can actually have access to annual health check depending on the plan you purchase. So annual health checks are checks that allow you to at least do those, maybe the high blood pressure check,
Optical.
optical, dental. You can do what do you call it? Kidney function, lung function, depending on
Right.
what your plan gives you cover for.
Yeah.
So some of these things are things you can do even though you don't have symptoms.
Mm-hmm.
You can also, some plans give you access to the gym membership that can do maybe
Right.
once a week or twice in a month or whatever it is. You also have access to, we spoke about the telemedicine,
Yes.
speaking to a doctor from the comfort of your home or office. You can actually do that. You can also have speak to a psychologist.
So mental health
Is a
care.
mental health care. So mental therapy. You can speak to someone, and so many things you can do even without necessarily visiting the hospital.
Right.
So optical or dental is key. People can go do their eye tests.
Check your eyes. You're
Check your eyes.
squinting. People are
Yeah.
squinting while watching this video, but they
Yeah.
will go.
So go check your eyes. Go check your teeth. You can do scaling and polishing just to feel good. So
Clean your mouth.
yeah, these are
people.
things you can do with your health plan. Yes.
Okay. I think that helps. So what should people look out for? We keep talking about all of the benefits. So I hate the word layman, but for someone who wants to start off on their health insurance journey, what are some things they should consider before making a decision? What are things they should look out for before picking a health insurance platform or a health insurance plan?
Okay. All right. Yeah, so to help you make a decision while picking a health insurance plan, one, you should look at the benefits. What are you looking for? What kind of coverage do you have in mind? The hospital spread as well. How many hospitals can I access? Do I have access to these hospitals when I'm not in my primary location? What else do you look at? Affordability. Of course, that's very key, especially in the Nigeria of today. If you can't afford it, then there's really no need buying. There's nothing you can do about it. So affordability is also key in making that decision. So I think that's about that. I don't know if I'm forgetting anything. But
I think that should be able to help or guide someone in picking a plan. So someone asked me a question, I think 2 days back, and for me, I thought about it because I've never thought about it that deeply. If someone has an emergency, you're unconscious, you don't have your health insurance details, right? You're rushed to the hospital, but you have health insurance. They have to attend to you. What's the process? Like how it's urgent care. How do health insurance companies step in? Because everybody thinks that, okay, you can just walk into the hospital and access your benefits. What if you're carried into the hospital? How can this be useful? Yes.
Okay, maybe an accident happens and something, and okay. Yeah, it's something, everybody asks that question because I have a health insurance and I'm unconscious. What happens to me? Yes, the health insurance will step in hopefully when the person becomes conscious, one, or two, when a relative escalates. Yeah, sometimes if the hospital that the person has been taken to has the HMO has a relationship, a partnership with the hospital, makes it a lot easier. Yes, so the hospital can quickly just step in and start, attending to the person. But a situation where there's no partnership, the HMO will still step in at some point. But the difference is they need to be informed.
The moment there's consciousness.
There's consciousness, one. The moment maybe someone that knows this individual is aware and can quickly escalate, even if the person is unconscious, and tell, oh, this is what it is.
Yeah.
We need you guys to come through.
Mm-hmm.
The HMO will actually come through at that particular point in time.
Yeah.
So, sorry, just to add that, it's always a tough one, especially in situations where someone is unconscious. Maybe the person does not have. Usually, HMOs will issue an ID card.
Mm-hmm.
So if there's no ID card found on the person's body,
Mm-hmm.
it becomes also a challenge. But the good thing about it is that the HMO or the insurer will come through when they are aware that a situation like this has occurred, and they can take it from there.
Okay.
Yeah.
And then there are also refunds, like
refund.
according to the limits of your plan.
Exactly. So situations where people have had access out of their network in cases of emergencies,
Mm-hmm.
and they didn't have the opportunity to get to a partner hospital,
Yeah.
there's a refund process.
Right.
Yeah. So just to mention that the refund is based on your plan benefit. So if your plan does not cover a particular service, then the HMO cannot
not refund.
for that particular
Okay.
service. So long as your plan gives you that coverage, then there's a refund process in place
Okay.
to take care of that.
So, and this is part of me also recapping. It's not a blank check. The fact that you have health insurance does not mean everything I need to do is going to go on my insurance company.
Yes.
So you would always be refunded. You would always be taken care of according to the limits of your plan. So
Yes.
you have the responsibility to understand what your plan covers for you.
Exactly. It's
Nigerians,
very, very
we
important.
need to read more. I don't like that myth or that popular misconception. Not a misconception, because we don't read. We don't like to read.
Okay.
I feel like more people need to read.
To understand.
Even if you don't read for fun's sake, for things that affect your life.
People sign documents without reading.
They sign.
And when the chiefs are done, like, did I sign? You didn't read it.
You didn't read it.
That's why it's that way. You can just read.
Your health insurance plan would literally put beside every service.
Yeah.
It's covered up to 100,000. It's covered up to 500,000. It is not covered. These are excluded.
Definitely. Yeah.
Please, people, read.
It's important.
Understand it. We want to serve you, but you also have a responsibility to know what's available to you. So I feel like this has been such an enlightening conversation. Noye, how do you feel? Do you still feel nervous?
Yeah, no. I'm okay. I'm interested.
Would you come again if I drag you out?
I'll think about it.
Okay, so we've understood that health insurance is now accessible everywhere. You should factor in several things when you have to pick a plan. We've said, don't just think about only yourself. The people who work for you,
Very key, very important.
everybody who works for you, don't keep the information. The artisans, if some people, you had a laundry man come and pick your clothes to wash for years, and you can just tell him, okay, how do you handle your health bills?
You can gift people health insurance.
People health insurance.
Yeah, it's a good gift.
It's a good gift.
It's really a good gift. It's something I encourage people to do. All the monies you have to send home for people to go to the
Right.
hospital, why don't you buy a health insurance? And when you gift them this money, they're using it to do other things and not to go and pay hospital bills.
Exactly.
So
Gift
gift people health insurance. It's a good gift.
Thank you for mentioning that.
Yeah.
That's such an important point to note. So thank you for watching, guys. You could always catch up on previous episodes on the of the Just Kidding podcast on Apple, Spotify, YouTube. Follow us on our social channels: Instagram, Twitter. Sorry, no more Twitter. It's X. I'm still trying to get used to it. TikTok, and we'll see you some other time. Stay safe, stay protected, and take care. Bye.